Well, abdominal aortic aneurysms, or a rupture in one of the body's biggest arteries, is part of a disease not too many people are familiar with, but a medical episode which can prove fatal.
And now, in the past, the only way that a patient could have hope of surviving one was through an invasive surgery, but with some brand new technology, a less invasive procedure has been developed. It's giving patients more of a chance to live and have less time to recover. David Romero, we sent him out to talk with a doctor who's doing this and a patient who were the very first in the whole country to try this out, and it was right here in Albuquerque.
With a severe rupture to the body's large artery, which supplies blood to the lower portion of the body, a patient's life could literally hang in the balance.
The scariest part about aneurysms is that they don't produce symptoms. So the first sign of a problem is usually you're dying.
Previously, the surgical solution involved a real evasive surgery and opening up the patient to insert a device which would take the place of the torn wall of the artery. That has now changed.
Without incisions, big abdominal incisions, leg incisions, this is something that, again, we've done completely minimally invasively. Patients are able to literally walk out of the hospital, in most cases, in 24 to 48 hours.
The device is called a trivascular ovation prime stent, which features an O-ring that acts as a perfect seal once in place in the artery. The new device can be inserted through a vein in the leg instead of the patient being opened up in surgery.
The way that we traditionally do these procedures is with a gigantic operation where we have to completely open the abdomen, remove the intestine out of the way, literally block off the arteries for half of the body's circulation.
It's also cutting the procedure time by hours and recovery time by weeks.
For a conventional surgery that I described before, you're talking about 7 to 10 days in the hospital and another 6 to 8 weeks of rehabilitation.
And the rehab with this one is?
There's really no rehabilitation. You're going home in a couple of days.
David Romero, 2 KASA This Morning.
All right, as we mentioned, the groundbreaking procedure was performed here in New Mexico just a few months ago, saving the life of Joe Sanchez from Berlin. Now, coming up in an hour, David's going to introduce us to Joe and show us how the procedure saved his life when he was literally just minutes away from dying.
It's an amazing story.
Wow.
Yeah, they do a lot of great research here at the hospitals and some of the labs.
Yeah, absolutely.
Very lucky to have that.
Absolutely.